What if one of the most serious illnesses affecting older adults doesn't begin with severe pain or an obvious emergency, but with small changes that are easy to explain away? Maybe you've been feeling more tired than usual. Perhaps you've lost a little weight without trying, or your appetite isn't what it used to be. You tell yourself it's just getting older, or maybe you've been under a little stress lately. But what if your body has been trying to get your attention all along? One of the biggest challenges with pancreatic cancer is that its early symptoms can be subtle and easily mistaken for far more common conditions. That doesn't mean every unusual symptom is a sign of cancer, far from it. Most of the symptoms we'll discuss today are much more often caused by less serious problems. However, when these changes are persistent, unexplained, or begin occurring together, they deserve a conversation with your healthcare provider. And before the end of this video, I'm going to share one simple habit that many seniors overlook, a habit that can help you recognize meaningful health changes earlier and make those conversations with your doctor much more productive. Welcome back, and thank you for being here. If this is your first time visiting the channel, we're dedicated to helping adults over 50 understand their health with practical, evidence-based information that supports healthy aging. Growing older doesn't mean expecting the worst. It means becoming more aware of your body and recognizing when something deserves a closer look. Here's something we all know to be true. As we age, our bodies naturally change. Our energy may not be exactly what it was at 30. Digestion may become a little slower. Recovery from illness may take longer. Those are normal parts of life. But it's also true that not every new symptom should automatically be blamed on aging. Sometimes your body is sending a signal that deserves attention, and learning the difference can make a meaningful impact on your health. The pancreas is an organ that many people rarely think about until something goes wrong. Yet it performs two incredibly important jobs every single day. It produces enzymes that help digest the food you eat, and it makes hormones like insulin that help regulate blood sugar. When the pancreas isn't functioning properly, the effects can show up in many different parts of the body, which is one reason pancreatic conditions can be difficult to recognize early. Let's begin with the first symptom, unexplained weight loss. Have you noticed your clothes fitting more loosely, even though you haven't changed your diet or exercise routine? Perhaps friends or family have commented that you've lost weight, and you weren't even trying. While many people welcome losing a few pounds, unexpected weight loss, especially when it happens without any clear reason, shouldn't simply be brushed aside. There are many possible explanations for unexplained weight loss. Changes in appetite, thyroid conditions, digestive disorders, depression, medication side effects, and several other illnesses can all contribute. In some cases, pancreatic cancer may also be a cause because it can interfere with digestion and the body's ability to absorb nutrients. The important message isn't to assume the worst. It's to recognize that persistent, unexplained weight loss deserves medical evaluation rather than being dismissed as just aging. Imagine looking back months from now and realizing your body had been giving you clues all along. That's why paying attention matters. Early conversations with a healthcare provider often begin with something as simple as noticing that the number on the scale keeps dropping without explanation. The second symptom is a loss of appetite or feeling full much sooner than usual. Think about your favorite meal. Maybe it's something you've always looked forward to, yet lately you've noticed that after just a few bites, you don't feel interested in finishing your plate. Or perhaps food simply doesn't sound as appealing as it once did. Again, there are many reasons this can happen. Digestive problems, certain medications, infections, emotional stress, and other medical conditions can all affect appetite. However, when reduced appetite continues for weeks, especially alongside weight loss or other unusual symptoms, it's something worth discussing with your healthcare provider. Your body requires adequate nutrition to maintain strength, muscle mass, immune function, and overall well-being. Persistent appetite changes are your body's way of saying that something deserves attention, even if the cause turns out to be relatively minor. Now let's talk about the third symptom, and this one often surprises people because it can be mistaken for an ordinary stomach problem. Persistent discomfort in the upper abdomen that may spread toward the back is one symptom that healthcare professionals take seriously when evaluating pancreatic conditions. Some people describe it as a dull ache rather than a sharp pain. Others notice that it seems worse after eating or when lying flat, while leaning forward may temporarily provide some relief. It's important to remember that abdominal pain has countless possible causes. Indigestion, acid reflux, gallstones, ulcers, muscle strain, and many digestive conditions are much more common than pancreatic cancer. But if pain persists, gradually worsens, or is accompanied by unexplained weight loss, appetite changes, or other concerning symptoms, it's worth having evaluated rather than simply reaching for another antacid. As you're listening today, you may already be thinking about your own health or perhaps someone you care about. That's exactly why awareness is so valuable. The goal isn't fear. The goal is recognizing patterns. One isolated symptom that quickly resolves is often very different from several persistent changes that continue over time. I'd like to ask you something. Have you ever experienced a health problem that you initially thought was simply part of getting older, only to discover it had another explanation? If you're comfortable sharing, let us know in the comments. Your experience might encourage someone else to pay closer attention to their own health and seek medical advice when something doesn't feel right. We're only getting started because the next symptoms are among the ones people overlook most often. One of them can appear in your skin before you feel seriously ill. Another may show up during everyday trips to the bathroom. And one often catches families completely by surprise because it seems unrelated to the pancreas at first. That's why I encourage you to stay with me until the end. The final habit we'll discuss may be one of the simplest yet most valuable ways to notice important health changes before they become easier to ignore.